Hello everybody, welcome to my channel. This is a pathology video on hepatobiliary pathology. The topic is Criteria and Pathomechanism of Cirrhosis. This is by Dr. CSBR Prasad, Professor of Pathology, Sri Devarajaras Medical College.
Hello students, today we are going to deal with one of the liver pathology, cirrhosis of liver. In cirrhosis of liver undergoes fibrotic change. That means fibrosis occurs within the liver, and you should know the difference between a localized fibrosis and fibrosis that is occurring in the liver. If you look at a patient who is suffering from amoebic abscess, liver abscess, which heals by fibrosis, it is a localized process, and rest of the liver is unaffected. Architecturally, they are very, very normal. Whereas in the case of cirrhosis, there is diffuse fibrosis, and because of this diffuse fibrosis, there is loss of architecture of the liver. And this is a very important point one should understand, because in cirrhosis, liver loses its smooth surface and it becomes nodular. Hence, any liver which is having nodular surface doesn't mean that this liver is involved in cirrhotic process, because nodularity can be produced by different mechanisms of inflammation, and which results in some loss of tissue in particular areas, which is associated with the retraction and making the surrounding liver tissue as prominent. I will show you some of the images. By seeing them, you will understand the difference between the cirrhotic fibrosis and the fibrosis that is occurring secondary to localized varieties of inflammation. So this is the normal liver, where you can appreciate the smooth surface and it is brown in color, and you can see the ligament, falciform ligament, separating right and left lobes from each other. And this is the histology of normal liver. You can see the portal triad, central vein, and in between the hepatic cords, they are single cell thickness. So they are single cell thickness, and they are divided into three zones. Zone 1 around the portal triad, and zone 3 around the central vein. So as the blood flows from the portal triad to central vein, the nutrients and oxygen goes on depleting towards the central venal area. And hepatic cords and liver substance is supported by a reticulin framework or collagen framework, and this image highlights such a reticulin framework. This is a special stain involving silver impregnation, and you can see that reticulin fibers stained darkly. And in cirrhotic liver, the patient will have different clinical manifestations depending upon the severity of the disease process. And because it's a fibrotic process involving the liver becomes smaller, shrunken, and the surface will be nodular and irregular. And there will be enlarged spleen, we'll call it as splenomegaly. And in addition to that, the patient may suffer from portosystemic anastomosis. And this may manifest in the form of hemorrhoids in the anorectal area, and around the umbilicus it may manifest as caput medusae, and in the lower part of the esophagus it may manifest as esophageal varices. And in addition to that, the patient, because the patient's liver is not up to the mark in functional aspects, there may be increased levels of hormones, especially the estrogen levels, which are normally metabolized by the liver. And here, because of cirrhotic process, the estrogen is not metabolized, and there may be so these patients may have hyperestrogenic states, which can be appreciated by the presence of spider angiomas in the upper half of the body. So as the saying says, all roads lead to Rome, and any insult to the liver which induces certain cell death and inflammation and associated fibrosis may ultimately result in cirrhotic process. And I would like to stress again, cirrhosis is a diffuse fibrotic process involving the liver. And the term cirrhosis was introduced actually by Laennec, who invented STET. And cirrhosis is derived from a Greek term skirros, meaning orange or tawny surface of the liver. That means it is a yellowish orange colored surface of the liver that is commonly seen in the case of cirrhosis. And cirrhosis is an end-stage chronic liver disease, and there are three criteria that must be satisfied in order to call a liver to be involved in cirrhotic process. One is loss of architecture, second thing is bridging fibrous septa, and third one is regenerating nodules. So the architecture loss is represented by, say for example, in a normal liver, you'll have liver lobule, wherein at the periphery of the liver lobule there are portal triads. At the center of the liver lobule there is a central vein and hepatic cords radiating from these two structures. And this is a normal liver structure that can be appreciated histologically. So this architecture is completely lost, meaning the liver cords no more maintain their single cell thickness. There may be multiple cells and haphazardly arranged liver cells, and in addition to that, portal triad may not be related to central vein whatsoever. So there may not be many portal triads, and there may not be central vein at the existing liver tissue. So this is what we'll see in the case of loss of architecture of the liver in cirrhosis. And bridging fibrous septa, there will be bridging. That means it bridges it bridges a certain portions of the liver. Say for example, bridging can be between portal triads. So portal to portal bridging, or portal to central venal bridging, or it may be haphazard bridging. So because of this bridging fibrous septa, the liver is converted into lobules, so which can be appreciated morphologically. So if you grossly examining the liver that is involved in cirrhosis, surface appears nodular because of this bridging fibrosis. And in addition to that, when you cut this surface, you may appreciate lobularity and thick fibrous septa dividing these lobules into varying sizes. And in addition to that, liver has, you may be remembering your physiology, that liver has got enormous capacity to regenerate, and when there is insult to the liver which is associated with loss of hepatocytes, and the other remaining hepatocytes try to regenerate and reproduce the quantity that is lost. So in this process of cirrhosis, because of ongoing insult and loss of tissue, the patient's liver reacts in the form of production of newer hepatocytes, and they accumulate as nodules. We'll call them as regenerating nodules. So by definition, cirrhosis by definition should satisfy three criteria. One is the entire liver should lose its architecture, and there will be varying degrees of fibrosis, and these fibrous septa divide the liver into many lobules, and there may be regenerating parenchymal nodules. And fibrosis usually is defined as excessive deposition of extracellular matrix, especially collagen in the case of liver, and in most patients this fibrosis is irreversible process.
Thanks for watching. Please subscribe by clicking the button subscribe.